Hello, this cardiac rehabilitation education session covers stress management and anxiety. The respiratory and cardiac mental health team work with people who have any heart or lung problem and also experience increased anxiety, panic or low mood related to their condition. We know that when anyone is managing any health condition, it can have an impact on how you feel, how you think and how you behave. You might feel tense, nervous or fearful in difficult situations, like moving house or going into hospital. These feelings usually go away in their own time, and most people have felt like this at some point. It is common to avoid situations that cause us to feel anxious, and over time we may stop doing things as a way to avoid feeling anxious. This can often lead to changes in our mood and our levels of motivation, as we feel frustrated at not being able to do the things we used to do. Over time, this can become overwhelming and can affect our physical health too. This is a cycle of breathlessness and anxiety. You may become stressed, causing shortness of breath, which can make you feel anxious. When you're anxious, your breathing and heart rate can become faster, making your muscles tire due to the extra work they are doing. With this, shortness of breath increases along with anxiety, making your breathing and heart rate even more rapid and tiring your breathing muscles even more. This can lead to panic. The fight and flight response is a normal reaction that can happen when we are faced with a dangerous situation. It is triggered by the release of hormones that prepare your body to either run to safety or to stay and deal with the threat. There are both short-term and long-term effects of anxiety. The short-term effects are things we notice when we are feeling anxious or worried. They may include things like tremor, nausea, stomach churning, a dry mouth, changes to your breathing, changes to your vision, a tightness in your throat, tightness in your chest, increased heart rate, sweating or flushing, or muscle tensions. The longer-term effects tend to happen when someone has been feeling anxious on and off over a long period of time. It can be difficult managing increased anxiety, and over time we may feel overwhelmed and notice changes such as lacking in confidence, difficulty concentrating, an altered sleep pattern, low motivation, low mood, and avoidance. Low mood and depression are often described as no longer enjoying the things you used to enjoy and losing interest in your usual activities. You can have negative thoughts and feelings, including sadness, guilt, anger, frustration, and hopelessness. It can cause people to be self-critical, lack confidence, and affect your levels of motivation. Here are some things you can do to help yourself if you're feeling anxious or low in mood. You could try breathing techniques. There are various breathing techniques that can be helpful. One of the most common symptoms of anxiety is a difference in breathing. It can become shallower and quicker. This kind of breathing can make anxiety feel worse, so a simple breathing exercise can help. Talk to someone close to you, a health professional, or someone going through something similar to you. Distraction techniques can help to refocus your mind. These may include playing a game on your phone, reading, listening to music, or doing a hobby. Mindfulness. So mindfulness helps you be aware of what's happening in the present moment. It is not about trying to clear your mind, but being aware of your thoughts, emotions, and how you are feeling physically and mentally. Make time to schedule in some activities you enjoy, including physical and mental activities or challenges. You can make simple lifestyle changes, such as doing some exercise and keeping active. This might include moving more around your home, or going out for a short walk, walking up and down the stairs more often, or even chair-based exercises depending on how much you can manage. Eating a healthy, balanced diet is really important, and trying to keep into a good sleep routine. Keeping active can help to take your mind off anxious thoughts and reduce stress and tension. Try to recognise any patterns or triggers that cause you to feel anxious. Focusing on values. Think about what things or people are important to you, and if possible, spend more time doing these things or seeing these people. Talking therapy. Talking to professionals about how you feel. You could get a referral to the respiratory and cardiac mental health team. You could get a referral to IAPT, which stands for Improving Access to Psychological Therapies. This is a free service that offers a range of courses and one-to-one therapy, which can help with managing stress, anxiety, and depression. Self-help resources. There are many resources and websites you can access. Some examples include NHS Choices, Mood Zone, British Heart Foundation, and Headspace. Medication. Medication is not for everyone, but for some people it can be really helpful. Your GP may prescribe antidepressants or other medication which can help you manage your mood or regulate your emotions.